Everyone, this is the Allen Care Show. I am Elisa Walker from Allen Hospital in Waterloo. The Allen Care Show is now in our 8th year here on KBBG, and I just want to say thank you to all of my monthly listeners. We want to talk women's health issues and ways you can keep yourself and your family healthy. As you know, women tend to make most of the healthcare decisions for their families. So we'll talk about things that will help you make those choices. We'll also introduce you to the healthcare experts from Allen Hospital, Allen College, United Medical Park, and we will be happy to take your questions too. I have a very special guest with me today. Her name is Wendy Foote from Unity Point Health Allen Hospital Imaging Center at United Medical Park.
It's a mouthful.
It is. Our topic today is stereotactic breast imaging. Wendy, before we get started about the program, can you tell our listeners a little bit about yourself and the background that brings you to your present position?
Yeah, sure thing, Alyssa. I'm happy to be here today.
Thank you.
Thank you for having me. I've actually been in the x-ray field since 1995 is when I started school. I'm from out east, Maryland, so I went to x-ray school when my youngest was 3, graduated in 1997, and then took my boards and moved out here in 1998, and I've been working ever since at the United Medical Park. I started in the fall of 1998 and started out there actually doing general x-ray and mammography, and I actually did some orthopedic x-ray. And then when the imaging center actually opened up, which was just a few months after the main building opened, I started working for Allen at that point.
Oh, great. Now, what exactly is an x-ray technician?
We actually do all of the x-rays of the bones of the body, different procedures such as upper GIs, barium enemas. Currently, I no longer do x-ray. When I took my mammography boards, I found that that was my focus. I really loved that. So I've been primarily doing mammography for the last probably good 12 years now. And then I started to learn stereotactic breast biopsies about 6 years ago. And so I've been doing stereotactic biopsies, and mammography now are my primary focus. And I love doing both of those.
Well, great. I know that you're very busy because it is a very busy month, so let's just go in and get into the meats and potatoes. Share a little bit, why exactly are we here today, and why is October a busy month for you?
Yes, October is the month everybody is bombarded with get your mammogram. So it's great. I mean, we're happy to be busy. I mean, we just keep getting through our days and getting as many. We're happy. The more people that come in, the more people are getting what they need done, and we're always happy to see women taking care of themselves and getting their mammograms done. Today I'm actually here to kind of explain a little bit about stereotactic breast biopsies. It's a very common type of breast biopsy that's probably been done for the last 20 years or so. And when women come in and have their screening mammogram done, if we need to call them back for any additional views, which happens pretty frequently, they immediately become alarmed, which is very normal, and we understand that. And then if they come in and they have added views and our radiologist recommends a biopsy, then they become really alarmed. And they don't understand what the procedure is or what it entails. So I'm kind of here today to explain what stereotactic breast biopsies are.
Oh, that is great, because as you were saying that, I just envision a couple of my friends calling me, I got to go back in, what does that mean? So great.
Yes.
What is a typical call that you might get from a woman who has been referred to you?
Yeah. Well, when we call them back and say, we need you to come and have some added views, immediately they're like, oh no, I have breast cancer.
Yes.
And then we say, well, we just need to get some additional views and to determine, if there's anything going on in your breast tissue that's different. And so when they hear that word stereotactic breast biopsy, if they come in and that is the next step that the doctor recommends, then they get, like I said, very alarmed, and they have questions for us and concerns, and we try to explain that to them as best as we can. A stereotactic breast biopsy is actually an X-ray guided breast biopsy. It's a procedure that uses a computer, and it takes images in 2 planes that localize the lesion in the breast so that we know where to go to get that tissue sample. The tissue sample is actually taken out of the breast using a hollow needle that uses a suction device and uses a vacuum that kind of sucks that tissue out of the breast so that we can send it in to the pathologist so that they can figure out if there's something going on in that. If it's normal, it can be determined that way if it's normal or if it's abnormal.
Okay.
And really, that's the only way that you can tell 100% if there's anything wrong. It's important that, you know, if a woman is recommended to have one of those, that she has it done, because then we can tell if it's breast cancer, we can deal with it. If it's normal, you know, she can move on and with her life and get back to living. So
that is great. What else do women tend to ask you?
Well, a lot of times, primarily stereotactic breast biopsies are done for calcifications in the breast.
Sure.
So the women hear that word calcifications and they're like, what is that? And you know, I don't understand. I came in for my normal yearly mammogram. I don't feel anything. So the doctor says I have calcifications in my breast that need to be biopsied. What are calcifications? They want to know. And calcifications are just really small sand-like deposits in the breast that are normally occurring as we age, but sometimes those calcifications can be early signs of breast cancer. So if a lady comes in and we see these calcifications and they're new or they're different or perhaps they've increased in size or number, our radiologist will typically have us take those views we call magnification views, which makes them larger so the doctor can see them better. And when he sees them better, sometimes he can determine they're normal just by looking at them. But there's a lot of times when he's just like, oh, I'm not really sure. You know, and those are the cases that we say, let's go ahead, get that stereotactic breast biopsy done. So we can be sure that these are normal for you. And these calcifications then are what we're sampling during the procedure. We can take those little calcifications out of the breast and then they can be sent to the pathologist and he can do his examination under the microscope and determine whether it's an early cancer or just a normal breast condition.
And I noticed that you mentioned a hollow needle, and I'm sure that a lot of listeners are like, ooh, a needle. How big, how long?
We like to call it a probe, but it is a needle. It's not very small, but it's not really gigantic either. The reason why we need to have that hollow, kind of a larger probe needle is it needs to be able to suction out. It has a cutting device in it that allows that tissue to kind of be sliced and sucked out with a vacuum device. So it needs to be large enough so that we can get a good tissue sample. I mean, if we're going to go ahead and do a biopsy, we might as well get, you know, a good amount of tissue so that we get a good sampling to be able to be sure if anything is going on in that tissue that we need to worry about.
Now for pain, will they be able to take Motrin or ibuprofen or Tylenol if they know ahead of time they're going to have an exam? Or have this biopsy?
Actually, you probably shouldn't take anything beforehand. Afterwards they can.
Great.
But there is a numbing that is used, numbing medicine that is used during the procedure. So you shouldn't really feel too much during the procedure. But we'll talk a little bit more about that as we go on.
Are women afraid when we hear the word cancer?
And well, yes, of course. You know, when we get called back for our mammogram, isn't that the first thing that we think? Oh, I have cancer. And actually, you know, that's probably not going to be the case. The odds are actually good that you won't have cancer. Calcifications, like I was saying, are very normal in the breast. And we need to biopsy them if they're different, just to be sure. But actually, 80 to 85% of these biopsies come back as normal.
Oh, that's great.
It's really, your odds are really good. The other 15% that do come back as a cancer, they're usually the very early breast cancers that we call ductal carcinomas in situ.
Okay.
It's called DCIS, and those are actually contained in the milk duct.
Okay.
So those have not spread, or what we call metastasized to other organs, or so that is the good news. I mean, that is why you need to come in and get that digital mammogram done every year, because these are things that you
So
can't
important.
feel in the breast. And so this is the only way we're gonna catch them, is if you come in every year and have that mammogram, so
Yes.
we can see those early changes in the breast tissue.
Now, where do women go to have the stereotactic breast biopsy performed? Is it in the hospital?
It can be, actually, it can be in the hospital, it can be at imaging centers.
Okay.
It can also be at outpatient facilities or breast care centers. Usually, the procedure is performed either by a trained physician or a radiologist in the imaging department. At United Medical Park, we're really fortunate because we have the breast care center out there.
Yes.
And that's where I assist, is at the breast care center. I help Dr. Dubin performs the stereotactic breast biopsies. And that is nice because that is totally dedicated to the care and treatment of breast problems, concerns, and breast disease. But your doctor is actually the one who determines where you'll go typically.
Okay.
The one who ordered your mammogram, he'll suggest, you know, where he would like you to go. So usually it will either be done, like I said, at a dedicated breast care center or at the imaging facility, maybe where you had your mammogram done at.
Oh,
So-
that is great.
Mhm.
Now, let's say, Wendy, you just called me back and I need to come in to have a biopsy. How do I prepare for that?
Okay. Actually, having the biopsy procedure is pretty common, same practice as your mammogram. You're going to be asked to remove your top and bra, and you'll put on a gown. You'll also maybe be asked to remove your earrings, your necklaces, and eyeglasses, because they could maybe interfere with the x-ray images we'll be taking.
Oh,
Or
okay.
it might be uncomfortable, because you'll be laying on your side, and you know, you might not want to have your glasses or your earrings stabbing your ear. If you have long hair, it's kind of nice to have it pulled back.
Okay.
If you don't have anything to pull it back with, we have things to pull it back, or put it into a surgical cap or something to get it out of the way. And it's also really important, before you have this biopsy, to communicate with your doctor all medications that you are currently
yes.
taking, especially if you have any allergies to anesthesia. For the procedure, they use lidocaine and
Okay.
lidocaine with epinephrine. So if you have any allergies to that, that's important to let the doctor know. Also, if you are taking aspirin, even like a baby daily aspirin or any type of blood thinners,
Okay.
it's really good not to be on that for about 3 days
3 days,
prior
okay.
to your procedure. We can still do it if you are on a daily aspirin, but there's just an increased risk of a little bit more bleeding. So you might have more bleeding, because that's what aspirin is a blood
Right,
thinner.
right.
So it could cause a little more bleeding. And then also, you should inform your doctor if you have any medical conditions or any recent illnesses. And for moral support, it might be nice to have a friend or a relative come
Yes.
with you. Typically they don't come into the room during the biopsy, but even if they're in that waiting room for you afterwards, it's kind of nice to have
It
that
is. Yes, it
person
is.
out there. But typically, you wouldn't need to have anybody drive you unless you're pre-sedated. If you're very, very nervous or anxious, sometimes the doctor might have you take Valium beforehand. Now, if you were taking Valium or something, then you would, of course, afterwards need a driver to
Right,
take
right,
you home. So,
right.
yeah, but it's pretty simple, the preparation for it.
Our guest today is Wendy Foote from Unity Point Health Allen Hospital Imaging Center at United Medical Park. Wendy is here to tell us more about stereotactic breast imaging. This is the Allen Care Show, a program devoted to healthcare issues for women and their families. When we return, Wendy will tell us more about stereotactic breast imaging. I am Eliza Walker, and this is the Allen Care Show right here on KBBG FM.
All students in Iowa deserve a safe learning environment at school. And it only takes one
That is
caring
just-
adult
that
to
is
make
just
sure
great.
bullying
Sorry,
doesn't
I
get in the
deviated
way.
a couple
No,
of
you're
times,
Karen
but-
Warren,
you're fine. I know,
president of the
it
Iowa
kind
State
of went a
Education
little funny at
Association.
first, so I knew it.
Bullying has no place in our
That is
schools,
great.
and parents
That's
and
really
adults
good
have
to
the
know
power to
because,
stand up and stop the bullying, fix it,
I
and
have heard
prevent
women
it.
before who the Alan Care Show, a program devoted to healthcare issues for women and their families. We are here today with Wendy Foote from Unity Point Health, Allen Hospital Imaging Center at United Medical Park. And we've been speaking about breast biopsies. And we're going to ask Wendy, our expert, to share more about that. Wendy, can you explain how is the procedure performed?
Yes, I can. It's actually, specialized mammography machine is actually used to perform the stereotactic biopsy.
Okay.
It's a special table that actually has a hole in it where your breast falls through that hole. You lay on your stomach and your head is turned to one side and that breast falls down through the opening in the table. And then the table is raised and the biopsy procedure is actually performed beneath the table.
Okay.
So you actually don't see it, which is good. 'Cause
Which is
then
good,
you don't
yes.
see the size of that probe. The breast is actually compressed, just really kind of like your mammogram, you know, so the breast is compressed during the whole procedure, but you really don't feel it because, like I was saying, numbing medicine is used, and so it's held in position, your breast underneath the table with some compression. And then several images are obtained. We take x-ray images of the area of concern.
Okay.
Once the area has been located, the unit sets the target coordinates for the biopsy probe, which tells that biopsy probe, you know, exactly what depth,
Wow.
horizontal and vertical axis, you know, to go into the breast. And then a local anesthetic is injected into the breast to numb it.
Okay.
Once the breast is numb, the physician will make a small nick in the skin where the biopsy probe or that needle is to be inserted. And at that point, he'll put some more anesthetic, some more of that numbing medicine is placed deeper into the breast. And then the probe is inserted and advanced to the location of that abnormality or those small calcifications. And we do that using the x-ray and the computer-generated coordinates. More x-ray images are taken,
Okay.
just to make sure that the tip of the needle is where we want it at. So it's either, we want to make sure that that tip of the needle is within the lesion or in that area of calcifications. And then the tissue samples are obtained using a vacuum-assisted device which has a cutting tool that cuts and pulls that tissue using that vacuum suction. And that tissue is pulled into a small little basket chamber.
Okay.
And at that point, the radiologist actually doesn't have to, the radiologist or the physician doing it, doesn't have to withdraw the needle. It actually stays in the breast in that position. And the biopsy takes samples like the face of a clock. So it rotates in the breast. So it will take a sample, say like at noon, 3 o'clock, 6 o'clock, 9 o'clock, so that we can get a good sampling of tissue in that area to make sure that we, you know, remove as much in that area so we can get a good diagnosis.
So again, if he does need or she does need to have an x-ray, all of that can be done at the same time?
Correct,
Awesome.
correct. And then the tissue samples that are removed, I know women sometimes worry that they're gonna be deformed or something.
yes,
But they're
yes.
actually very, very small samples. I mean, they're like a little inchworm sample. And they only take out about 4 to 10, just depending on the area of concern and the probe or the needle that we use. We have a couple of different sizes we can use depending on the area. And then once the tissue samples are taken out of the breast into that little basket, we remove that and put it in a little petri dish.
Okay.
And then an x-ray tech comes over from the mammography department, takes that tissue sample back over to the mammography department, and we take an x-ray of it so that we can see the tissue that we removed and make sure that those little calcifications are in that tissue or that that lesion, if it's for a lesion, that that lesion is in that tissue. So we send it back over, and then when we're sure that we have that area of concern, a small marking clip is placed in the breast. This is a little tiny titanium clip It's
Okay.
like the size of your eyelash.
Oh,
It's
okay,
very
okay,
small.
very small.
And it's actually placed through that probe that we use to remove the tissue. It's placed in the site of the biopsy area, and that's kind of a roadmap for the doctor for future mammograms, or if your biopsy came back as needing positive for cancer or something and they would need to go in and do more treatment.
Okay.
That way they can see exactly where we were at and where that abnormality was by looking at that marking clip in the breast.
And how long will that stay in there?
That actually stays in there forever. I mean, it's
Oh, my
small,
goodness,
very
that is
small,
great.
and it doesn't set off
Mhm.
alarms in the airport or
Yeah.
anything. People are always concerned about that. But it's just a very small little clip so the radiologist can tell when you have your future mammogram, oh, yes, you had a biopsy there, you know.
Oh,
And
that
so,
is
yeah.
wonderful. Modern technology.
Oh, it's amazing.
And then it sounds like it's a one-stop shop. I mean, you go
It
from
is.
one to the other and back
And
to
I
you
like
guys.
that because a
Yes.
lot of times I do the mammogram on the patient,
Mhm.
I do the added views on the patient. When she has her biopsy, sometimes I'll be doing that too,
Uh-huh.
and then it's nice to see that patient, the whole full circle
Yes.
of care.
And I'm sure patients really like that as well.
They do, they do. Once we put that marking clip in there, that's at the time when the probe is removed from the breast.
Okay.
And then we'll hold pressure on that breast for about 10 minutes, just to make sure that the bleeding stops. You know, there's always gonna be a little bleeding with any nick in the skin, so it's usually
Sure,
not very
sure.
much. And then at that time, once the bleeding stops, we use little steri strips on there, which are just little small pieces of sticky tape that hold that incision together so that it heals nicely. And then we put some additional dressing over top of the biopsy. We like to ace wrap you up nice and tight just to keep pressure on the breast to reduce any bruising or swelling. And we'll give the patient a couple ice packs that we
Oh.
make up. They're just paper towels in the Ziploc
Exactly,
bag that-
exactly.
just to kind of conform to the breast and put some coldness there to help with the swelling and the bruising as well.
And I'm glad that you did mention cold versus hot, because I know sometimes there's some controversy regarding hot
When to
versus
use
cold.
cold and when to use heat.
Yes.
Yes, these are cold ice packs, so.
Great. Now, what do women experience during and after the biopsy? Are we going to be in pain? Do we need to take any time off from work?
No, you don't. Actually, that's the best, one of the best things about this type of biopsy. You'll be awake during the procedure, and you really should have little or no discomfort.
Okay.
The breast is well numbed for the exam, and most women will report to us when we do their follow-up calls the next day that they had no pain following the procedure. And also you have the additional benefit of there's really no scarring of the breast. I mean, this is a very small incision that's made just big enough to insert that probe through.
Right,
So there's no
right.
scarring, and there's no stitches. You just have those steri strips there on the incision to help it heal well. Some women find the biggest discomfort of the whole procedure is actually to be lying on that table on their stomach. You know,
Oh,
especially
yes.
for our elderly ladies, that can be very difficult with their necks turned to the side. And sometimes they'll have neck or back pain. We try to position them really well and use some strategically placed pillows to make them as comfortable as possible during the exam. Also, when you get that very first anesthetic for the procedure, you're gonna feel that prick, you know, you're gonna feel a little bit of a bee sting, and, but that will go away, and then you shouldn't really feel any more pain from the anesthetic when it's inserted. Also, you might feel a little bit of pressure. I always say there's a little pressure, a little tugging. It's not like you're gonna feel nothing, but you shouldn't feel any sharp pain. You're gonna know something's going on. But you shouldn't be in pain. The biopsy machine also kind of makes a lot of clicking noises, so that you'll hear that. And after the exam, we really recommend you to take an over-the-counter painkiller, whatever you would normally take at home.
Okay, okay.
Because it's that numbing's gonna wear off. You're gonna feel a little bit of, you know, pain
Tenderness
and
and
tenderness maybe there. So you normally would just take something afterwards, you know, just over-the-counter
Okay.
medication. And then, of course, you should contact your physician if you experience any signs of infection, which would be redness, if it starts to bleed and you can't get it to stop after you've applied pressure, or you have drainage, or you start running a fever. Those are all concerns that you should call about if you have them.
Okay.
So, and you can, like you were asking about work, you can certainly, a lot of women go back to work right after the procedure that day. And you can do that, we just don't want you to do any heavy lifting or
Okay.
pulling or tugging. We always say no cooking, no cleaning, you know. So, I mean, just kind of take it easy, kind of treat yourself to a nice day if you can. And you can get back to work the next day and get back to your exercise or whatever you want to do the next day. And we'll call you then. We typically call, well, we always call the next day,
Mhm.
make sure that, you're doing well, that you had a comfortable night of sleep, and just answer
Oh,
any
good,
questions or
good.
concerns that you might have.
Good.
So,
I know we talked a lot about women, and in the minutes that we have left, what about men? Can men get breast cancer?
yes, men can get breast cancer, and they really need to, if they feel a lump in their breast, I mean, we don't screen women yearly like men. Men don't get screened yearly like women, I should say. But they can have breast cancer, and if they have a family history of breast cancer, that increases their risk just like it increases a woman's risk. So if they feel a lump, they need to go in and get a mammogram done. And if they need a biopsy, they typically don't have this type of biopsy, because usually for men,
Mhm.
they can feel it. And if they can feel it, they can do an ultrasound guided
Mhm.
biopsy, where they can go in and basically do the same kind of thing where you take a tissue sample and see if they have breast cancer. But they do need to be aware that
Yes.
breast cancer is not just for women.
Great,
So-
thank you. And then, Wendy, what about for those who are uninsured?
We have.
Are there programs?
Yes, we have the Beyond Pink team, very well here in town. And we have the Care for Yourself program with Gabby DeWitt at the Blackhawk County Department of Health.
Which is
It was
fabulous.
fabulous, and a lot of women don't realize they have that resource
Yes.
out there. Oh, I'm constantly telling women that say, oh, I had to come in because, my insurance, I'm losing my insurance, and I'll say, don't forget, there are programs out here for you to continue to have your mammogram done yearly, so it's important to take advantage of those.
That is great. And then also with the new marketplace, mammograms will be covered as one of the prevention
Yes.
services for women. So I want to make sure that our listeners know that. So now
It's
there's
very
no
important.
reason not to have
That's
a
right,
mammogram.
and it is not painful, ladies, come on in. Every lady that I have come in for their first mammogram, they're always like, this was nothing. What is
Exactly.
everybody talking about? So really, we can make you comfortable. It's a 5-10 minute procedure. It's just get it
Great.
done.
Yeah,
Get it
yeah.
done.
And I think we just give ourselves so much anxiety, the workup, and then like you said, after it's done, it's like, really?
Yes. That was nothing.
Now, Wendy, how can women learn more about this procedure, and how can they get in contact with you?
Okay, you can actually give me a call at the United Medical Park. I'm at the Allen Imaging Center out there. My phone number there is 319-833-6001. If you have any questions at all about, what this biopsy is about, and if you should have it done, and what to expect, there's lots of benefits to having this type of biopsy. And we're actually really fortunate that we have this technology today, as opposed to the old
Yes,
type
we
of
are.
biopsy where you'd have to go into the OR and
Yes.
have a big incision done, be put under, and a scar afterwards.
Yes.
So this is a great procedure. So if you have any questions or concerns, you can certainly contact me. I'd be happy to help in any
Great.
way.
And happy Breast Cancer Awareness Month.
Yes, it's October, so get out and get your mammogram done.
You've been listening to the Allen Care Show, a show for women and their families. My very special guest today has been Wendy Foote from Unity Point Health Allen Hospital Imaging Center at United Medical Park. Please join me next month, November 21st at 10 a.m. right here on KBBG FM. That was a
It's a mouthful. I don't know where to tell people I work now. I'm like, Allen, you need
I know,
to
because you said you
Imaging
didn't want to let
Center.
Where did Alan go? And I'm like, okay.
I know, it's so